Disruptive behaviors and psychological symptoms such as depression, apathy, anxiety, agitation, wandering, and resistance or refusal to care from others are all common in dementia. It's important to keep in mind that all behaviors have a meaning, and it's just a type of communication. An individual showing disruptive behaviors could mean that a person is overstimulated, understimulated, or has an unmet need. There are different types of triggers that can cause these behaviors. And if you're unfamiliar with the term triggers, it's just a sensory reminder from an internal or external stimuli that cause certain symptoms and behaviors to occur. Different types of triggers that can cause disruptive behaviors are communication, environmental, and physiological triggers. The goal is to figure out the cause of behaviors and then to do something to resolve the problem. Some common triggers regarding communication are speaking too loudly and using too many words, moving too fast, so this would include just doing things with the individual too quickly and in a way that might cause some confusion and agitation. So you want to make sure that you're moving at a slow pace and giving them time to process what's going on. And this would move into the next trigger, which would be not explaining what's being done. So when you're working with the individual, you want to make sure that you're explaining what's being done, but using minimal words to make sure that they are not confused about the activity or the task at hand, and they are not becoming agitated by this confusion. And the last trigger would be arguing with the individual. So if there is any confusion from the individual about what's being done, you want to make sure that you have a calm voice and you are explaining those things with simple words.
All right, so we're going to be talking about a few communication strategies that you can use with your loved one who has dementia. One of them being give one step at a time, and then another one being demonstrate different activities instead of explaining them. That can make things a little bit easier. Okay, Mindy. So I need you to watch me first. And then you pick a color. And pick where you want to start. And one other communication strategy that can be used with individuals who have dementia is using a statement and not a question.
I'm hungry.
Let's go get some breakfast.
Okay.
Something important to keep in mind is to always speak calmly and slower than normal. Allow for additional time for a loved one to process information.
I'm just getting hungry.
Okay, what do you want? We had eggs yesterday. Do you want bacon and toast, or do you want orange juice? Do you want eggs again with maybe some cheese?
Sweet.
Sweet. Okay, so maybe orange juice and like a fruit salad and maybe some protein so we can have some peanut butter on your toast. Okay, so that was something not to do. So something you could do is, for instance,
I'm just getting so hungry.
okay, well, how about we have some toast like we did yesterday? Sweet. Okay. I know you like bananas. Do you want bananas? Okay, let's do that. Another strategy that's great to use for individuals who have dementia is to validate what a person is saying by repeating their statement and then redirecting them to a more positive statement.
I miss home.
I know you miss home, but before we go home, let's get some lunch first.
Okay, I am hungry.
Okay, sounds good.
Some common triggers regarding the environment are not knowing where they are, not knowing what time or what day it is, loud noises like alarms or trains passing, and then lack of engagement or activity that could lead to boredom. Some strategies to prevent these triggers are to provide good lighting to avoid any sort of confusion, to avoid television shows that are too loud for them and might be disturbing, and then using headphones that could give them their favorite music or cancel out any sort of noises within the environment that are distracting or disturbing to them. And then providing possibly a cup of tea or a piece of candy just to make sure that they feel a little bit more comfortable and relaxed. And then having a daily calendar is really helpful just to let them know what day it is, so possibly circling the day or pointing it out to them. And then having it in a place where they can easily see it, just so they know what's going on that day and possibly who's taking them to certain events. And then taking them outside for some fresh air is always a good way to help them feel more comfortable and to provide that extra sensory stimulation. And then possibly giving them a hand massage with some pleasant smelling lotion. The last common trigger that is common for individuals with dementia are physiological triggers. And if you're not familiar with the term physiological, this is just a term that refers to normal human function of living things. So some of these triggers include pain, discomfort, incontinence or not being able to control their bowels or bladder, and then hunger and thirst. Some strategies for addressing physiological triggers are to provide pain medication at the prescribed times, and then look for any nonverbal signs such as pain, grimacing, wincing, or muscle guarding, which is just covering any areas that are uncomfortable for them. And then make sure that they're attending regular doctor visits just to prioritize their health. Complete toileting every 2 hours before and after meals. Have them wear clothes such as sweatpants just to make dressing and undressing a little bit easier. Make sure the loved one eats frequent meals and that they also have healthy snacks such as nuts, fruits or vegetables, and then drinks readily available to them. And then aim for 6 to 8 cups of water a day, and then finish at least 2 hours before bed. Remember to be patient with your loved one. Look for signs and symptoms and try and figure out what's causing the problem. You can use these strategies to try and resolve the problem to make your loved one feel more comfortable.